Embolism, pathophysiology, diagnosis and treatments. Embolism is a term derived from the word embolus, describing a matter that travels through the bloodstream from primary location to secondary location. Most of the emboli consist of blood clots that are dislocated from their point of origin, especially deep leg veins. During orthopedic surgery or long bone fracture, trace of fat can be released into the bloodstream, thereby causing blockage of blood vessels, hence blood clot. Spinal cord injury and high double trauma causes embolism.
An amniotic fluid embolism is a rare but very dangerous form of embolism which involves amniotic fluid, fetal cells, hair and other debris entering the mother's bloodstream, triggering an allergic reaction. It is thought to occur via uterine trauma, which results in small cervical tears, or via the lower uterine segment. There are three pathological reasons that amniotic embolisms can occur. Firstly, debris can enter the bloodstream via a tear in the uterine wall. Secondly, inflammatory effect of the amniotic fluid embolism on the maternal circulatory system. This leads to a release of inflammatory mediators, leading to some experts claiming that an AFE is more closely related to a septic shock. Thirdly, an immunological reason suggesting that fetal antigens can stimulate a cascade of immune mediators. This results in a mixture of plasma and active granulocytes, leading to a pulmonary collapse. Diagnosing an AFE is particularly difficult as it can only be determined via an autopsy. However, a fall in haemoglobin, a rise in white blood cell count, prolonged prothrombin and partial thromboplastin, which is a medical test that characterises blood coagulation, can all be used in indicating a possible embolism. A treatment of AFE is not preventative, but only supportive. The following treatments can be used: maintenance of oxygen, monitoring of hemodynamic function, correction of coagulopathy, pulmonary artery catheter should be inserted for hyperdynamic evaluation. This should all occur within a hospital setting, as things can take a turn for the worse very quickly.
Fat embolism. Fat embolism is the process by which fat tissue passes into the bloodstream and lodges within a blood vessel, mainly due to trauma or fracturing of long bone. Fat embolism syndrome is a serious manifestation of the phenomenon of emboli, resulting in a variety of symptoms. It is also the main cause of acute respiratory distress syndrome. Earliest manifestations of fat emboli are tachycardia, elevation of temperature above normal, and dropping of partial pressure of oxygen in arteries. Cause of fat embolisms is either traumatic or non-traumatic. Traumatic could be fractures of long bones and the surgical instrumentation of medullary canal. Non-traumatic could be neoplasm, severe infection, renal, blood transfusion, diabetes, and so on. Mechanical theory. A constant rise in marrow pressure above venous pressure allows fat droplets to enter the circulation via torn blood vessels. In biochemical theory, toxic theory, which is through hydrolysis of neutral fat to chemically toxic free fatty acids due to lung lipase. Free fatty acids cause endothelial damage and inactivation of lung, and also lung permeability. Mediators affect solubility of lipids that are released from the fracture site, resulting in embolism. Diagnosis of fat embolism is radiography evaluation, which is, for example, dyspnea, lab findings such as in hypoxemia, biochemistry, and ECG test. Treatments, it could be either respiratory support, which is a full support of the respiratory with mechanical ventilation, and second one is steroid therapy to decrease inflammation reaction in lungs.
Brain embolism.
Retinal embolisms, it occurs when an embolus lodges within the ocular vessel, affecting arteries and veins within the retina. When artery is affected, it causes CRAO when it affects the central arteries, or BRAO when it affects the branched arteries. When the veins are affected, it causes CRVO, which is the central veins, or BRVO, which are the branched veins. Retinal artery occlusion occurs when an embolus lodges in the retinal artery, causing the photoreceptors, which are the rods and cones, to become ischemic. The photoreceptors start to fail, causing partial or complete blindness. This severity of blindness depends on the type of embolus and the extent of the occlusion. Retinal artery occlusion occurs when the embolus is lodged inside the veins of the retina. Blood flow away from the retinas are blocked. This extended blockage causes hemorrhaging, swelling and other pressure-related damage such as edemas. Consequent pressures may also block arteries, causing further blindness. Risk factors of atherosclerotic emboli include hypertension, diabetes mellitus, history of vascular disease or familial history of microvascular diseases. Non-atherosclerotic emboli have the risk factors that include sickle cell disease, hypercoagulable states, which are caused by clotting protein deficiencies, and the use of hormonal contraceptives. To diagnose retinal emboli, ocular examinations are used to show the location and the number of the emboli. Retinal occlusion can be a precursor to other embolic events such as strokes and myocardial infarctions. To prevent these, fasting blood glucose and cholesterol must be taken, as well as a full blood count. If the patient is under 40, hypercoagulable states must be determined. These show a cholesterol emboli in the central artery, and this white area here shows the ischemic area of the retinal branched occlusion. This shows the hemorrhage site due to a vein embolism. To treat a retinal embolism, the physician may perform an ocular massage to mechanically dislodge the embolus. Chemical lysis of the embolus is also used, but carries the risk of intracerebral hemorrhage, or vasodilation drugs are used to widen the vessels to allow the embolus to move.
An air embolism, also known as a gas embolism, is the entry of air into the vascular system through surgical, e.g. keyhole surgery, or non-surgical, via a diver resurfing too quickly. Pathogenesis. Air can enter the vascular system via a shift in the pressure gradient. Once at the heart, it creates an intercardiac airlock at the pulmonary valve, leading to a prevention of blood ejection. This airlock then forces the heart to increase the force of contractions in an effort to inject more blood. This then creates small air bubbles that break loose from the impact and travel through the system. Diagnosing an air embolism. This can be done by a transesophageal echocardiography, a Doppler ultrasound, a pulmonary artery catheter, or a CT scan can be used. Treatment involves hospitalisation, where the patient receives sufficient oxygen at the bedside after the source of embolism has been eliminated. Divers are treated immediately via resurfacing in a hyperbaric chamber for
Embolism is a specific type of embolism caused by a bacterial infection resulting in PATH. When the infectious matter moves from its original location and enters the bloodstream, it causes a blockage in the. This can happen during placement of intravenous catheters, when bacteria gains access into the intravascular space. When the bacteria breaks off for patients that this happens during the placement of intravenous catheters, or when bacteria gains access to the intravenous space by colonizing the first half of the lumen of the catheter. Once the bacteria enters the circulatory system, it multiplies, causing the endothelial damage. This can be treated using antibiotics. You take a culture of the bacteria. You take a culture of the bacteria to determine which bacteria is causing the infection. Then you can treat the patient initially with spectrum antibiotics which treat both negative gram-positive bacteria. You take the sample, then you can determine which antibiotic to use specific to the bacteria that's causing the infection. Other methods that can be used is coil embolization, or you can remove it surgically.
Thromboembolism. Thromboembolism can be many things, but it normally occurs due to a blood clot within the vessels that were thrombocytes and thrombin. An example of a thromboembolism would be pulmonary embolism. Many factors that contribute to the cellular and the molecular processes of pulmonary embolism. One of it would be the degree of blockage, so that would mean the size of the blockage, whether acute or large. Another factor would be if the patient has experienced any cardiopulmonary conditions before, such as stroke, heart attack, etc. Pulmonary embolism has different processes. First one would be the emboli obstructs the pulmonary circulation. Therefore, mechanically, there's less blood flow through to the pulmonary arteries and veins, which cause other problems.